So this presentation is on why gender and sex is very important to understanding and knowing the difference in the healthcare field. And this is for RNs and PCTs. Um, so I'm just going to ask you a couple questions. In your definition, what is gender and sex?
Um, I've taken a couple of classes that I've gone over this. From what I can remember, gender is more of like a societal thing. It's more of like what someone thinks they are. It's more like things like cultures tied into gender, like in general, like what each gender does more like if men are more into hunting and sports, then that's more of like a gender type thing. Whereas simply having a Y chromosome that's sex. That's like it's more of a genetic thing.
Yeah, so gender is a social construct, so it's like when boys can only like the color blue and girls can only like the color pink, and boys can't play with dolls, that kind of thing.
Mm-hmm.
And it's also an individual's concept of how they feel about themselves, what they most identify with in society. And then as far as sex, it's the physical characteristics. So just think back to puberty, the voice cracks and the facial hair. That's when that comes into play. And it's just basically genetics.
I could see that being a problem in healthcare because what if someone identifies as a gender or what basically identifies as the opposite sex? Because if they require certain medications, certain treatments, and they have a different endocrine system, I could see that being a problem.
Yeah. So when these two things conflict, it's known as like transgender, non-binary, gender non-conforming, or gender fluidity, and that's not really something that we as healthcare workers ask, at least not in like an admission assessment.
Mm-hmm.
So basically, the scenario, if this were to go terribly wrong in the healthcare field, is if a woman, let's say 20, walks into the ED. She's having some shortness of breath and chest pain and lots of anxiety. So automatically, just they're thinking it's not a heart attack because they don't have the same symptoms as men.
Mm-hmm.
And actually, most, like I think 80% of heart attacks by women go undiagnosed. But so she's having shortness of breath, chest pain. They do an EKG and it doesn't show anything. They do chest X-ray, see if she got some type of pneumonia, and then that's also negative. So they work it up for, having some anxiety, and they send her home on some Xanax or whatnot. But what they fail to ask her is if she's on any medications that can cause her to clot. A lot of medications that they're on when they're transitioning can cause strokes, they can cause PEs, they can cause DVTs, all throughout the body, which those things left untreated can be deadly. I mean, you end up with a hemorrhagic stroke and that's it, and you're 20. A lot of birth controls even do that.
Yeah, I used to work with a female who's transitioning into a male, and he would take a really significant amount of testosterone. In fact, I think it was more so than like what like bodybuilders would even take, and it was inconsistent too because it all depended on how much he worked that week if he was able to like afford it because insurance wouldn't cover it because it's for cosmetic purposes. Mm-hmm. And I could see that causing some problems, especially if it's inconsistent because I don't know if it works the same as other endocrine hormones, but like sometimes your body might become resistant to a certain hormone if you use a lot, and then you get off of it, and all of a sudden now you might be out of whack, and you get back on it, and you're taking the same amount. And all I know is that I can increase chances of like heart attack and stroke and clotting and stuff like that. So
yeah. So not knowing these things and not asking about them is a big problem in society because when we do an admission assessment, we ask them about everything. We ask them about suicide, we ask them about weight, we even ask about medication, but sometimes they're not outright and forthcoming because they're, transitioning. It's not a comfortable process, so that's why you have to ask them how they, identify, to make sure that they're not on any medications that would affect them in that way.
Yeah, you would want to know what sex they were when they were born, what one they're trying to become, because all the medications. So just in case, like, say they were born a female, you'd still want to know that, even if they identify as a male, because what if you need a test for pregnancy or ovarian cancer if they're having symptoms?
Because they're still going to have the same medical problems because of their physical attributes.
Yeah, so you'd have to have that like conversation to be like, I know you're, or first, are you transitioning? And if they are, then you'd still need to ask them, what gender were you when you were born? And that would be difficult, I think, but necessary.
Yep. I think that covers why it's pretty important to know what the difference between gender and sex and how it affects our patients.